AP imaging of the leg. Our patient must be supine with a leg extended and resting on the IR. We need to center the leg to the IR and adjust it so the femoral condyles are parallel to the IR, and our foot is vertical, and the ankle must be flexed into a 90 degrees angle. And we must consider including both joints of ankle and knee in our image. Our center leg is perpendicular to the meet point of leg, and our coulometer is 1 inch or 2.5 cm inside, 0.5 inch or 8.3 cm beyond the ankle and knee joints. If we are not using a grid, our KVP is 70, but with using a grid we must increase it to 80. In lateral imaging of leg, we have to turn our patient towards the affected side with the leg resting on the IR. We must center the leg